A woman is the heart of a family. A woman with a healthy heart can make a healthy family. Hello everyone, I am Dr. Aruna, working as a consultant cardiologist at KIMS Hospitals, Kurnool. Today I want to share a few facts about cardiac health in women. Fact number 1. Heart disease is the number one killer in women. It contributes to around 1 in 3 deaths each year. So it is almost more than all the cancers combined together. Fact number 2. Heart disease can affect women at any age. Almost 45% of women aged 20 years and older are suffering from some or the other forms of heart disease. Fact number 3. Fortunately, all these cardiac events can be prevented by having a healthy lifestyle like eating healthy, walking more and controlling your blood pressure to the optimal level. Now, after knowing all these facts, I would like to tell you what are the major cardiac disorders which occur in any person. So, the first most major cardiac disorder is coronary artery disease or heart attack. In women, this is the major silent killer which occurs silently, leading to more of deaths, that is heart attacks. So there are different symptoms and signs which differ in both men and women. So it occurs because the heart attack is narrowing of the coronary arteries supplying blood to the heart, which occurs due to plaque buildup in the artery due to atherosclerosis and calcium deposits. The major symptoms which we all know is chest discomfort, a feeling of pressure, squeezing, constricting type radiating to both the arms and back associated with sweating. So this is the common symptom in both males and females. But in females, majority do not present with these symptoms, but they present with atypical symptoms. Hence, we need to know about atypical symptoms which are like indigestion, nausea, vomiting and tiredness. Excessive tiredness or fatigue for a long time. So if you are having any tiredness for a long time, you need to get your cardiac checkup to rule out coronary artery disease. So number 2 cardiovascular disorder which occurs commonly is heart failure. So heart failure means the heart is beating but the pumping is inefficient. So it does not pump efficient nutrients and blood to the various organs of the body. So it can occur at all the ages, especially in pregnancy, which we call as peripartum cardiomyopathy. So number 3rd disorder is arrhythmias. Arrhythmias means abnormal rhythm of the heart. Heart might beat very fast or very slow, or it might beat irregularly, which in turn leads to decreased heart function. So these are the major cardiac disorders which affect both men and females. There are some myths like heart attacks occur more frequently in males than in females, but this is wrong because nowadays the trend of heart attacks is increasing in women and it is at par with males. Especially after menopause, the rate of heart attacks is almost equal in both men and women. So after knowing the cardiovascular disorders, we need to know about the risk factors which leads to these cardiovascular disorders. In women, the major risk factors which contribute to heart attacks or other cardiovascular disorders are, first one is hypertension. Hypertension of more than or equal to 130 by 80 mm mercury needs to be controlled. Especially in women, we do not go for checkups regularly and this is underdiagnosed, and even in hypertensive women, only 23% keep their blood pressure in control as per the research. Second risk factor is uncontrolled diabetes mellitus. Third risk factor is higher LDL cholesterol levels. Fourth one is smoking and alcohol, which is being more done in urbanized areas in cities. And the fifth one is physical inactivity and weight gain and obesity. And sixth risk factor is stress and depression. So research has shown that stress and depression is leading to more of heart attacks. And unique incidences which occur in a woman's life are 2 major incidences. One is pregnancy and one is menopause. So in pregnancy, almost 10 to 20% of pregnant women are suffering from some or the other form of cardiovascular disorders, especially high blood pressure leading to preeclampsia and uncontrolled gestational diabetes and seizures. All these women, they go further later in life having cardiovascular disorders twice the highest risk than the same pregnant women who are not having these risk factors. And coming to menopause, women have a protective role prior to menopause due to the hormones which they have like estrogen and progesterone, but after menopause these hormone withdrawal occurs, and hence more of heart issues or cardiovascular disorders occur post menopausal period in women. So after knowing all these risk factors, so here I would like to tell you one good thing, that there are 8 essential lifestyle habits which we can make in order to prevent, treat or end all these disorders coming nearer to us. These 8 healthy lifestyle changes include: you need to keep your blood pressure under control by avoiding salty diet, and keep your LDL cholesterol to less than 50 to 70 mg per deciliter by avoiding oily diet and unsaturated fatty acids in your diet. And you need to avoid keep your blood sugar levels in control. Any random blood sugar sample should be less than 200 mg per deciliter whenever you check your blood sugars. And you need to keep yourself physically active to avoid overweight or obesity. So obesity we can measure by means of body mass index. Body mass index in Google we can calculate, it is having a formula like weight by height in meters whole square. We need to keep this body mass index less than 30 to avoid overweight or obesity. So in order to keep this, we need to maintain physical activity like 150 minutes of exercise in a week, or at least 30 minutes per day for 5 days in a week. So it should be of moderate intensity exercise like walking. Nowadays we are having smart watches also, so we can keep smart watches and calculate our steps in a day. It should be around 6,000 to 10,000 steps per day to maintain or to reduce your weight. So another thing is, you need to combat your stress and depression levels with yoga, meditation, and you need to know your family history of risk factors, what are the cardiac disorders running in our families, so that, and at what age our ancestors had the cardiac risk factors, so that we can also prevent these similar cardiac events occurring to us by taking prophylactic measures. So these are the various, we need to have healthy sleep of 6 to 8 hours per day. So these are the 8 essential lifestyle changes we can make, and definitely cardiovascular disorders are preventable, treatable, and it is having complete cure if we take appropriate action at the right time. So with this I end this small topic, and I am privileged to share this message with all the co-women, and I advise you all to kindly get your cardiac examination done. If you are less than 50 years of age, get it done at least yearly once. If you are more than 50 years of age, please get your cardiac checkup done at least 6 monthly once. Thank you so much. Have a healthy living, have a healthy heart. Thank you.